The pain is real, but your labs came back fine. Hearing that is maddening. You are living with a relentless ache, yet the tests insist everything is perfectly normal. When medical professionals can't point to a fractured bone or a torn ligament on an X-ray, a quiet suspicion often creeps into the conversation. They might suggest the discomfort is psychosomatic. You start to feel isolated, wondering if you are somehow imagining your own suffering. The standard medical playbook usually tries to treat the physical symptoms in a vacuum. Doctors say, let's just fix the pain first. This sends you down a rabbit hole of specialist referrals, new prescription medications, and endless waiting rooms, usually resulting in deep treatment fatigue when nothing provides a lasting solution. But that approach ignores how our bodies are actually wired. The human nervous system does not file physical sensation and emotional mood into separate isolated drawers. They run on the exact same circuitry. Because of this overlap, attempting to isolate and cure a chronic physical complaint without addressing your psychological state is a biological dead end. You simply cannot treat half the circuit and expect the whole system to heal. This diagram shows exactly how that shared circuitry operates. We have two distinct pathways here, one carrying physical pain signals and another regulating emotional mood, and they merge into a single neural node. They actively alter each other's state in a continuous bidirectional relationship. Let's look at the first direction. Living with persistent physical pain sends a continuous stream of distress signals. Over time, that constant firing heavily overflows into the mood pathway, chemically elevating the risk of developing clinical depression. Now watch the reverse. When depressive symptoms take hold, they send signals back down the line. This actively lowers the threshold at which your brain registers pain, amplifying the intensity and frequency of the physical signals you feel. Depression and chronic pain act as mutual biological amplifiers. A static physical injury that should have leveled off instead becomes a progressively worsening condition, driven by this internal feedback mechanism. Looking at this flowchart, we can trace the 5-step behavioral loop triggered by this overlapping circuitry. It always starts right here, with a physical pain flare-up. That initial pain inevitably makes it hard to rest. It disrupts your healthy sleep architecture, preventing you from reaching the deep, restorative stages of sleep. Waking up with a sleep deficit directly increases your neurological pain sensitivity. Your nerves are frayed, meaning things are going to hurt more today than they did yesterday. Your natural response to that heightened sensitivity is to protect yourself. You start shrinking your radius of movement, avoiding activities so you don't trigger another flare. But that reduction in movement comes at a steep cost. By staying still, you eliminate the hobbies, the socialization, and the daily routines that naturally regulate your nervous system and lift your mood. This resulting isolation creates a sensory vacuum. Without positive inputs to process, your brain has nothing else to focus on, giving the physical pain much more room to dominate your nervous system. This triggers an even larger flare-up. By the time you complete a few cycles of this loop, the decline in your daily function vastly outpaces the original physical injury. The loop itself has become the primary disease. Treating this condition requires an entirely different approach. Instead of doctors trying to prove the pain isn't there, the focus needs to be on strategically breaking the behavioral chain reactions keeping you trapped. This is where evidence-based psychological therapies step in. Cognitive behavioral therapy, or CBT, and acceptance and commitment therapy, known as ACT, have the strongest clinical track records for this dual-target approach. Rather than debating the existence of the pain, these therapies target specific vulnerable links in the loop. They improve sleep hygiene and establish activity pacing, helping you spark a values-based functional re-engagement with your life. Psychological therapy doesn't replace traditional medical care for your injury. It works right alongside it, helping to rewire those overlapping circuits and reduce your body's overall sensitivity to the pain. Of course, there is a paradoxical barrier to getting this kind of care. When you are suffering from severe chronic pain, the physical act of commuting across town to sit in a therapist's office is often entirely unrealistic. That mobility barrier is why 100% HIPAA-compliant telehealth has become such a crucial structural solution. You can access the therapy from exactly where you are. Coping and Healing Counseling, or CHC, is built specifically for this. They serve clients across all 159 Georgia counties, offering a highly diverse, culturally competent team of licensed therapists right through your screen. They also remove the financial hurdles. CHC offers a $0 copay for Medicaid, and if you have commercial plans like Aetna, Cigna, Blue Cross Blue Shield, United Healthcare, or Humana, sessions typically run just $10 to $40. You may not be able to rewind time and prevent the initial physical injury, but you have the power to take immediate, accessible action to dismantle the feedback loop that is making it worse.